Hello. Thank you for visiting us today. This is the Feet Forward Show brought to you by the Illinois Podiatric Medical Association. My name is Gloria Johnson, and with me today is Dr. Bela Pandit. Dr. Pandit has a practice in Evergreen Park, Illinois. You want to give the audience a little information about your practice before we get started?
Yeah, it's a complete podiatric medicine and aesthetic practice. We have a medical spa that we just built, and since our topic today is about some summer foot care, I have a lot of expertise in that. And then, of course, we do everything involving the feet and ankles, and anything that can go wrong, I take care of it.
That's right. Well, Dr. Pandit, like you said, our topic is pedicures and summer foot care. And what the viewers are very fortunate because today we are offering a special social media feature involving a free giveaway. So we'll talk about that later, but there's some really cool items, so just stay tuned. Well, it's summer, sort of.
It's sandal season.
Yeah, and summer foot care is, the pedicures and the getting your feet all pretty. I mean, that's what we see initially, but it's also important health-wise, isn't it?
It's very important. Sometimes people overlook their feet, and when it actually gets warm, they're starting to wear sandals, they start to notice maybe some problems with their feet. Typically in the summer, we see a lot of people noticing skin problems or nail problems that maybe they neglected during the winter. Okay. So that's probably the biggest thing I see.
Okay, I wanted to remind you that this is a live format that allows you to call in and ask any question regarding foot care, not just about our today's topic, pedicures and summer foot care, but any foot concern you may have, you can ask Dr. Pandit. She's here at your disposal to answer any question you have regarding foot care. Going back into pedicures, what do you recommend when visiting, or tips can you offer when visiting a nail salon?
Generally, I tell anyone it's not about the price. It really doesn't matter if you're spending $100 for a pedicure or $30 for a pedicure or whatever. You really want to look at the place. You want to look that it is clean. You want to see their whirlpools. If there's whirlpools and they don't seem sanitized, you don't want to go there. Mm-hmm. You want to make sure that the instruments are individually wrapped and sterilized afterwards. It's okay to ask how they sterilize it. Sitting it in a cup of water or what you think is alcohol is not okay. And feel comfortable with who you're working on your feet, especially if you have any health problems like diabetes or high blood pressure or something of more concern. You don't want to trust your feet with just anyone.
In your office, what complications do you see or have you seen pertaining to pedicures?
The number one thing I see is fungus that people get from the salons, either from the whirlpool, because that water is recycled over and over again, or the instruments that they're using. Sometimes they'll use the same file on everyone, and it just breeds that fungus, which makes your nails really dry and brittle and in different colors. It's very unsightly.
Okay, looks like we have a caller.
Hi, thanks for taking my call.
All right.
I just wanted to ask, is there a way to try to find a rating system on foot care places, or is there like an online website that kind of gives a place like an A, a B, a C, or anything like that?
Are you talking in terms of a podiatry practice or more of a salon?
Well, I guess both, if there's one for either.
I mean, a good place to start is probably in Chicagoland is Yelp. People are pretty honest on that site, and they'll give star ratings. In terms of physicians or podiatric medical practices, Rate MDs is big. Those that use ZocDoc is really honest. Those are probably your most trustworthy sites for this. And of course, word of mouth. If you have a friend or someone who's very happy with their foot care, that's probably even more reliable.
Great. Thank you so much.
Thanks.
Thank you. All right. In terms of problems with your or questions about a nail salon that you think is a little shaky, you can visit us, not us, but the Illinois Department of Professional Regulation They have a website that lists the nail salon, the licensed nail salons throughout Illinois, not just Chicago. So if you have any, concerns, or even if you want to make a complaint against a nail salon, you can visit this website, then go to the professional regulations section. Then there's another section where you select a profession title to view. So, and then they'll pull up, there's a drop-down list that will show different professions, and of course you would pick the nail salon. So
I'd like to also throw out there that there's a lot of podiatric physicians these days that are also offering medical pedicures in their offices, which are very, very safe and very sterile. So that's an option too. If you're not too sure about the salon in your neighborhood, you may want to look up one of our podiatrists that are part of the Illinois Podiatric Medical Association that do this.
yes, and of course our information regarding a referral for a podiatrist is right behind me. So any foot concern, like if you want to actually see someone, just visit our website or give us a call. And the number is listed. I can read it to you too. 888-869-3338. Now,
I think we have a caller.
Oh, we have another caller?
Yeah.
Oh, how may we help you?
Hi, doctor. I always wonder about this. I try to stay away from them self-service places where you try on your shoes. And
Right.
a lot of times I see people be trying on shoes without no socks or any type of barrier on their feet. But isn't in most places they have a city ordinance or something like that? But even if I go to those places, I keep a can of Lysol.
Yeah,
Is there any type of city ordinance? I don't want to sound like a big, like an official or anything like that. I always thought it was some type of city ordinance where people cannot be trying on shoes without no type of barrier on their feet.
that's a fantastic question, and there is no city ordinance that I know of. And you would think that this is something that is common sense among other people as well, that maybe you should wear socks and have that respect because someone else might try on that shoe afterwards. I see a ton of warts and fungus that are caught from people trying on shoes. And you would think, I always say at least bring your own socks. And then, hopefully that shoe hasn't been tried on too many times with someone that had something. But
And one of those times, when I have gone bowling and when I don't bring my own shoes, I don't take a chance. I bring my own Lysol and
Smart.
spray the shoes myself.
Good for you, and you should do that. There's a couple of devices out there now that have a UV light that you can put your shoe on, and it'll kill all the bacteria and fungus. So for someone like yourself, you might really enjoy
Doctor,
having that.
Doctor, I don't even want to say about on hotels. Bring your
Oh,
own
yeah.
UV light and, and go across those beds and sheets and things. You'd be surprised.
Oh yeah, it's scary business. I'm in agreement.
Take care.
Take care.
You. We have a question. The caller hung up. They want to know, is there any harm in jogging or running without socks?
I personally feel that there is. I think you should wear a moisture wicking sock at all times. Feet are naturally going to perspire, which can cause blisters, friction, and other ailments on the foot that, I know that the whole barefoot running thing is very popular right now and debatable, but you should still invest in a good pair of socks. It's better for you in the long run.
Yeah. Wow. You're talking about jogging. I tried, and, that's not about what this show's about. Anyway, what changes in your nails can be seen, or what do they say about your overall health? Like, what do bad nails reflect about your overall health?
Sometimes nails can reflect a lot of things. One, it can reflect age. They tend to get thicker and more brittle as we get older. Two, they can obviously show a lack of nutrition or dietary concerns where they're flaking, peeling. That usually is some kind of vitamin deficiency. Sometimes we can catch liver disease with the nails. And also, of course, we were talking about fungus and some of that stuff. Usually, somebody is slightly, their immune system might be a little bit compromised if they keep picking up things like that in the nail. So, a couple of things to look for that are not normal are any red spots, any black spots. We've caught several skin cancers in the nail, so you want to be careful with that. Any leaching of like a pigment, like a brown streaks through your nails, you definitely want to see your podiatrist for that. And then, anything that just doesn't look right. There is no harm in seeing your local podiatrist for that.
Yeah, I believe we have a question.
Yes. Good afternoon, ladies. How you doing?
Hi.
Thank you.
Great. Doctor, I got a question for you.
Sure.
A diabetic, only thing I take is metformin. I did just switch over to Victoza, whatever that is. Took me out to Bayetta. My A1C is wonderful.
Great.
The question that I want to ask is this. Is it okay to get your toenails cut maybe once a month? Or, when you think it's need to be cut, instead of waiting, some podiatrists want you to come back every 2 months or every 3 months. So the question is this: is it better to, when I think is need to be cut, because I prefer to go in once a month and get my nails cut.
That's an excellent
so
question.
Let me get out there, doctor. Let me get out there so I can hear your response.
Okay.
And thank you for taking the call.
Thank you for calling. This is a common question. Most podiatrists usually recommend 2 to 3 months, and a lot of that is unfortunately based on insurance reasons. That's typically when insurances will cover certain services. If you feel like your nails are getting long within a month, it's not that your podiatrist won't do it, it just may not be covered by the type of plan that you have. So that's something we'd have to look into. I do think it's a hazard if your nails grow that fast and that long to have them break and peel off and maybe cause an open wound. So, obviously we don't want you doing it yourself. We don't want you going to anyone that's not professionally trained to do that when you're diabetic. So I would talk to your podiatrist about that. A lot of times in my office, we charge very minimal for coming in earlier than 2 or 3 months. So, and thank you for calling.
Goodbye. Speaking of diabetes, what's your advice to individuals or diabetics when it comes to pedicures?
I don't recommend it unless it's in a medical spa at the podiatrist's office who is watching and overseeing that technique, and their staff is a little bit different. They're usually medical nail technicians. They're trained almost like a nurse to do this type of thing. I don't recommend it. Now, painting your nails, if you have a family member that just wants to throw on polish for a day, that's fine. But anything that's sharp, files, clippers, any of that, you don't want to do that.
Now, I've seen this, had an issue with my not just me but other people with the gel pedicures. They last longer. They're very pretty, but what do they do? In terms of, are they worse for your nails or what?
Here's the issue with the gels. They're cured by UV light. They need to be removed professionally. So the problem that happens with people is they get the gel manicures, pedicures. They look beautiful. They're super shiny, 2-3 weeks, and then they're trying to remove it at home. And when they're doing that, they're peeling off the top layer of keratin from their nail, which is causing your nail to be either peeling or injury prone. So you don't want to be doing that at home. You really need a professional to remove it. It does dry out your nail. You are soaking afterwards in pure acetone, so it's going to dry out your nail. You need to take breaks from those gel manicures too. You can't do that every 2-3 weeks. You have to intermix with a regular pedicure or manicure.
All right. As promised, I wanted to highlight our Facebook promotion that we're having on our Facebook page. Let me just set this up here. Oops. Oh, it does. Well, you can see most of that. Okay. Anyway, you can, if you go to our Facebook page, we're offering free giveaways of some fabulous products, foot care products, nail polishes, special nail polishes, foot lotions, and we'll discuss that a little bit now. Excuse me. In terms of what you should use, or what we recommend in terms for fungal or slather or
creams or moisturizers or antifungal, anything. I know one of the products we're giving away, which is excellent, is the Doctor's Remedy nail polish. It's antifungal, antibacterial, highly recommended by podiatrists, only distributed through medical professionals. It's wonderful polish, high quality, long lasting, beautiful summer colors. We use it in our medical spa in the office, and I absolutely love it. One of the best polishes I've seen in a long time.
that has special ingredients in it, doesn't it?
Yeah, it has some antifungal properties, some tea tree oil, and some antibacterial properties as well. So you know your nail is protected when you have that on.
All right, and we have actually, that's one of the items we're going to be giving away. We have 3 others. Bon Vital foot cream, or foot balm is what they refer it to. I have to find it. And just set this up. Sorry about that. Okay.
So the Bon Vital is a wonderful product as well. It comes on almost like a lip balm. It's a different type of vehicle. It's a wonderful kind of moisturizing coating for your feet. It smells great. Everybody loves this product. It's a nice daily maintenance type of product. It would be great to use this summer.
It's also good after a bath, isn't it? Right after you take that bath and you slather it on your foot.
You absorb that a little bit and lock in that moisture from your shower or bath. It's wonderful.
All right. And here is another item, Amlactin foot cream.
Amlactin is so highly recommended by most podiatrists because it is a moisturizer as well as it has properties to help shed some dry skin. Those dry, cracked heels that everyone suffers from the summer or from running or from working out, it really does a great job taking care of that. I like to recommend putting on the Amlactin at night with some socks for a couple of hours if you can stand it, and your feet will feel baby smooth.
Wow. Our last item is actually for fungal, directly for fungal. Now, so Dr. Pandit is going to tell you a little bit about that. Carousel nail.
The carousel nail is a great topical treatment for if you have mild nail fungus, which is common to get in the summer. And the thing with carousel is nice is because it's a moisturizer, an antifungal, and it also helps kind of just remove that top layer of dry, brittle nail in a very slow fashion. So it's not like your nail's peeling overnight, but you'll start noticing improvement probably within a week or two. Your nail will feel much better, it'll be much more supple, and have a better look to it. Great topical, and it's also great as a barrier prevention. If you, as one of our callers mentioned, you're going to a hotel, you're going on vacation, it's a nice protection to kind of put that layer on, and you feel a little bit more safe when you're out there.
Thanks for calling feet forward.
All right. I think we have a caller.
Just turn down your TV set a little bit. Okay.
Welcome to Feet Forward.
Yes, I have another question to ask you.
Yes.
This is the gentleman that was calling to ask you about the podiatrist getting your nails cut.
Mm-hmm.
It's just a vain thing that some people have, you know. But the question I want to ask you, do you promote a diabetic putting his foot in the foot massager? You know, you put the warm water in a little soap and let it stay in there for about a half hour. And number 2, I heard an old-time remedy that they always say that you could take Vaseline and you put it on your feet at night and sleep with sweat socks on. I don't particularly like to sleep with socks on, but they said that it will help massage the foot. So those are 2 questions I want to ask you. And if you do promote the foot massager, how long you think that your foot should stay in the warm water? Just make your feet feel good. Again, let me get out there. I hope you understood what I asked, right?
Yes, I got it.
Okay, let me get out there so I'll carry your response again. Thank you.
Okay, thank you. So foot massagers, or the kind of at-home baths that this caller mentioned, is a hot topic. With diabetics, I'm very, very cautious about it. I don't trust diabetic sensation in the feet to really know the temperature gauge of that whirlpool massager. So I always tell people to check with their hand, or if they have a loved one at home that can check the temperature. Unfortunately, I have had patients that have had their feet amputated by having their foot in too hot of a water. You don't want to probably soak your foot more than 15 minutes. Lukewarm water is best. And if you know you're insensate in the feet, you're not feeling things in the feet, or you have constant burning or tingling, I really would be cautious about using those whirlpools. Now, in terms of the Vaseline, yes, it works. The Bon Vital that we mentioned is probably a much more upgrade from regular Vaseline, but it has that balm quality. If you are putting it on your feet and you're diabetic, and whether it's Vaseline or any kind of moisturizer, you want to stick to usually the bottom of your feet, not between the toes. You'd put more on the heel than you would on the top of the foot, and absolutely none between the toes, because you risk having degradation of the skin, open lesions that way. The sock wearing, it does help moisturize, but again, being diabetic, you want to err on the side of being cautious. So maybe an hour or so. I would not sleep with that overnight. The skin's too tender for that. Thank you, caller.
Thank you. Okay. Now, once again, you can receive these items that we mentioned earlier on our Facebook page. If you go to it and just to our Facebook page, which we let me show it to you again, and just like us, and that's it. And we will send that out. Okay, Facebook.com Illinois Podiatric. Oh, thank you. Medical Association, and we do have limited quantities, but these are terrific products, and you will not be disappointed. Yeah. I mean, they're natural. They using a natural product it's so much better than I mean,
you have to worry about the toxins we put in our bodies these days. So the more natural it is, the better. High quality products, and hey, you get to try it for free. Can't beat that.
That's right.
Yeah.
We'll mail it right out to you, just like us.
Yeah.
Okay, now, when going to the salon, it's often recommended, specifically even by podiatrists, and the American Podiatric Medical Association recommends this, to bring your own instruments.
Highly recommended. Okay. And I tell all my patients, if you're not going to go to a podiatrist for these pedicures, you definitely want to even bring your own base coat. That base coat is used on every single person in that salon. So that person with that green nail before you, use that same base coat. Bring your own file, your own nipper, your own cuticle pusher. If no cuticle nippers, that's dangerous. Basically, bring everything with you and skip the whirlpool. That's I don't know if that takes the joy out of some of it, but just go for a longer massage and skip the whirlpool is what I recommend. And be careful with that base coat.
Wow. All right. And also, you can go on our website, www.ipma.net, and you would go into the resources for patients. We have a library full of tips on how to take care of your nails and the best good pedicure treatments, and a lot of recommendations on what to do with your feet and how to take care of your feet. I mean, and not just, of course, about pedicures, but any health issue. Please visit our website for that information. Also, you can look at our Facebook page. We often have information on the latest goings-on in regards to what's happening in podiatry, new research. So we try to keep you up to date on that. So, feel free to visit us on our Facebook page and on our website. You'll learn a lot of information about taking care of your feet. Okay, well, was there anything that you could think of in regards to how people can take care of their feet?
Just be safe this summer. When in doubt, don't do it. If you can do something at home safely by yourself, sometimes that's the best option. And when in doubt, ask your podiatrist. We're friendly people. We'll answer your questions, no problems.
Okay. Well, thank you for visiting us today, and we'll hope to come again soon, air soon in a few weeks. And don't forget to see a podiatrist if your feet are in pain. Visit our website, because pain is not necessary if you don't have to suffer. Just see a podiatrist. Thanks.
Thank you.
Bye.